Hi, beautiful people. How are ya? I hope you're having a great day. I explained what a cure means in a video recently. I went into more detail in the video intestinal permeability and SIBO in fibromyalgia. So please check that one out. And more recently, I did a video on gut microbiota and probiotics. So you can find all of them in the playlist titled Cures series. Today's video is about gut bacterial infections. So here we go. In that 2008 study that we've been talking about in some of the previous videos, 11 of the 40 fibromyalgia patients were found to have Helicobacter bacteria, 27.5% of them. And also 9 of the patients had either Campylobacter or Yersinia, which resulted in 22.5%. The article doesn't state whether it was an additional 9 patients or if they were included as some of the patients with the other pathogens, but either way, Helicobacter pylori, called H. pylori, is an infection that occurs during childhood and can be spread from person to person. But only 20% of children have symptoms. Dull or burning stomach pain, unplanned weight loss, and bloody vomit are symptoms. In children, the infection is most common in crowded conditions and areas of poor sanitation, but anyone can get it. You can be tested for H. pylori antibodies, and if positive, treatment may include lifestyle changes, such as eating more fruits, vegetables, and fiber in your diet. The infection can multiply in the mucus layer of the stomach lining and duodenum. The bacteria secrete an enzyme called urease that converts urea to ammonia. This ammonia protects the bacteria from stomach acid. As H. pylori multiplies, it eats into stomach tissue, which leads to gastric ulcer and or gastritis. H. pylori is a common cause of peptic ulcers, either duodenal in the small intestine, which is called duodenal ulcer, or gastric, which is in your stomach, called gastric ulcer. Most ulcers are caused by H. pylori bacteria. This infection may be present in half of the human population. Most people never get sick from H. pylori infection. But if you get an ulcer, green cabbage juice, kombucha, honey water, and turmeric tea can help soothe it. Avoiding coffee, alcohol, and carbonated drinks can help. Probiotics have been found to be helpful too. Follow your doctor's advice. And in addition, NSAIDs can cause ulcers over time. Gastritis is also found to be caused by H. pylori, but only some people with the infection develop gastritis or upper gastrointestinal disorders. So don't worry. It could be inherited or a lifestyle choice, such as your diet or smoking, that can be the cause. Or it could be NSAID use. Older adults have an increased risk, and excessive alcohol, stress, or cancer treatment can subject you to gastritis. Gastritis is an inflammation of the stomach lining. Digestive juices are allowed through the stomach wall when weakness or injury to the mucus line barrier occurs. Then damage and inflammation of the stomach lining is involved. A number of diseases and conditions can increase the risk of gastritis, including inflammatory conditions like Crohn's disease. Also, an inflammatory condition called autoimmune gastritis, where the body attacks the makeup of the stomach lining and wears away the stomach's protective barrier, can occur. But this is more common in people with other autoimmune diseases. If this is left untreated, it can lead to stomach ulcers and stomach bleeding and increase your risk of stomach cancer. Talk to your doctor if you're experiencing any of these uncommon symptoms. Campylobacter and Yersinia are bacteria that are the most common cause of diarrhea in the U.S. Campylobacter infection is a type of stomach flu, gastroenteritis. Our puppy got gastroenteritis after we fed him some dog food we thought would be good for him, but it made him sick. People usually call this food poisoning. Yersiniosis is caused by handling or eating raw or undercooked pork, or drinking milk or water that is contaminated, among other causes. These bacteria often clear up on their own, but SIBO can also be caused by these bacteria. After a bad instance of food poisoning, a few weeks later, you may notice you're bloated and have frequent diarrhea. You got over your food poisoning incident. Now you just got diagnosed with IBS by your doctor. The Campylobacter jejuni infection is often found in SIBO. A course of antibiotics is a standard medical treatment, which makes sense since it's usually caused by the jejuni infection. This is normally associated with endotoxins. Endotoxins are derived from gram-negative bacteria, as in Campylobacter jejuni. These are principal mediators that stimulate the synthesis of cytokines, as in TNF-A, IL-1 and IL-6, IL standing for interleukin, and other pro-inflammatory mediators by monocytes. They are toxic substances bound to the bacterial cell wall and released when the bacterium ruptures or disintegrates. They consist of lipopolysaccharide and lipoprotein complexes. They can cause fever and produce an immune reaction. Management of symptoms, nutritional support and supplementation for deficiencies, and a short, strict diet to manage symptoms can help. If there is a motility disorder, motility agents are usually prescribed. A low-carb diet and probiotics are often needed, but studies are often inconclusive as a solution. But adding good bacteria daily with probiotics are often relied upon. I hope you see the benefits of natural products that can help us feel better. We'll continue this series in the next video on biofilms. So I hope you learned something. I send you gentle hugs and support. Love you. And more recently, I didn't like that.